for that introduction. It actually was quite a lot. Before I begin, I would like to wish everyone who's present it's present over here, so I believe it's present up there as well. I don't know, but then yeah, good afternoon to all. And I would like to thank the organizers for giving me this opportunity to come on this forum and enlighten the students forum about what clinical psychology is and what is its scope and what it entails if somebody is planning to take a career path in clinical psychology. Let me just begin by saying a few things like and can I request some of the students at least can turn on your cameras? I would like be happy to see some of the faces rather than just talking to the screen. That would be just one request if possible. And second, at the end of the session, thank you Priyanka. You just did it and then you again turn it off. Thanks. So it's good to see lovely faces, right? I mean, why should we be just talking to the screen? Let's see each other and have a conversation. It's always good to see each other. Yeah. And also at the end of, I would like to, keep it very brief. I was told it will be for about 20 to 30 minutes. I would like to, wrap up what I have to say about clinical psychology for about 15 minutes. And I would like to, take questions from you guys for the next of the 15 minutes, okay? The reason, I think the basic fundamental rule about clinical psychology is if at all you are beginning to, or thinking to go into this career is that, in psychology, there is nothing called right and wrong, okay? So at the end of it, when I'm done saying what I have to say, please feel free to ask your questions. Right or wrong does not matter. Just ask your questions, okay? I mean, just use the opportunity. All right. So let me just begin by saying typically, like, what does the work of a clinical psychologist looks like? And then, I'll tell you how to go about that. So basically, like what a clinical psychologist does. So clinical psychologists would, typically would go in the morning, unlike pandemic. Let's check out the pandemic part. Let's, have a good fantasy that there's no pandemic. And then, the clinical psychologists have good breakfast and then, go to the office and, go to the chamber, consulting chamber, where he or she sees his or her patients, would begin to see the clients, typically for 45 to 50 minutes. Sometimes some professionals would do it for 1 hour. Okay, and generally we like to keep a gap between two patients for about 5 to 10 minutes so that you have some time to keep the notes and if you want to have something to absorb with the previous sessions. So basically the work looks like having a consultation with people from different spheres. It can be children, it can be adolescents, it can be teenagers, it can be adults, elderly people. So a work of a clinical psychologist typically involves having in consultation with anybody who needs it. Now, many times you would be asking these questions: who needs consultation? So basically, obviously there are people who are going through mental health crisis or mental health issues. Those are the ones who will be coming for consultation. So somebody suppose would come to you by saying that, okay, I am not being able to concentrate for quite some time now. My productivity is going down. I'm not being able to eat. I'm not finding interest. I mean, help me out. This could be one scenario. So clinical problems. Like the other setup would that be, some people would come and say that, look, I do this crazy thing of, checking the, whether I've locked the door or not, 2 times, 3 times, 4 times. I know I have locked it, but I just can't stop myself doing it. So that could be another kind of problem with which they would come. So there are clinical problems. So there would be some people who don't want to come, who think there is no problem, but their family members would be like, nee, isko dekh, kuch to hai. Okay, so you will get clinical problems. There would also be some sort of people coming to you who would come with these questions like, whether I should, go abroad for my studies or not. So, dilemmas, conflicts, interpersonal relationships, all sorts of things. So if you're a clinical psychologist, you can definitely expect anything from a query to a full-blown clinical problem. It can be anything what comes under the purview of your work. It can be, consultation about career. It can be, you may not do consultation on that, but then people would make such inquiries to you. Would be conflicts, would be marital issues, would be issues dealing with their children, all sorts of things would come into your work. Now, what is the nature of work? It is extremely, extremely interesting work, I would say. Okay, yeah, we will take questions. Huh? It's a very interesting work because, personally, I can tell you as a clinician, each case for me, unfolds a different journey altogether. It's like, you're entering a maze, and then, you don't know where this maze is taking you. I mean, you start from one problem, and then, it kind of have a root somewhere very deep down in the childhood, typically. And that makes our work very, very interesting. You get to see people from all backgrounds, doctors, lawyers, for sometimes politicians, who makes a very interesting, cases, I would say. And then lawyers, all sorts of students. You get very interesting case studies. And if you're really passionate about human mind, exploring what is, if you might have come across this phrase that if the mind is stranger than fiction. If you believe in this, I mean, this profession is for you. Clinical psychology actually gives you a glimpse of how mind is really stranger than fiction, right? So that's basically the work looks like. And again, it depends. We'll talk about the scope later. So basically, how do you, because I've already started getting questions about universities and all, so let me get straight into the topic. So if you are into your undergrads right now, doing psychology honors, you first have to finish your master's in psychology, preferably clinical psychology, but that's not really has to be. So if you are undergrad in psychology honors, finish up with your master's in psychology or clinical psychology, and then you have to give an entrance test to get into a training of clinical psychology, which in India is MPhil in clinical psychology. Up till now, there are about 24 institutions for sure which provides training in clinical psychology. It's a 2 years program, and each institute has an entrance examination. Okay, you have to crack that entrance examination, which is typically based on what you have learned in your undergrads and your post graduation. So it has some part of personality theory, some part of research, some part of general psychology. Each institute has a different set of questions and maybe one long answer type. So you attempt that, and then you crack it, and then you get into the program. It's a 2 years program, MPhil in clinical psychology. Upon the completion of this training, MPhil in clinical psychology, you can get yourself registered with RCI, that is Rehabilitation Council of India, and then you get a license to practice in India. You can set up a clinic for yourself, or you can work with an organization. I'll talk about the scope later. And then you begin going. Now, with MPhil in clinical psychology, there is also a new program which has come up, which is Psych-D. Okay, this is also a clinical program, which is typically done if you enroll for this course after masters. This is for 4 years. If you enroll for after MPhil, this is for 2 years. Okay, if you're doing your MPhil and want to go for Psych-D, so basically there's a lateral entry, so you just have to do another 2 years. So it's again a rigorous clinical training program, which is right now offered by just one institute in India. That's Kaur. Okay. And it's again, would entitle you to do a practice in clinical psychology. And there you go. So that's about, Psych-D. Now, that's about MPhil in clinical psychology and Psych-D. So in India, typically, you need to have a training in MPhil in clinical psychology to practice, because it's a rigorous clinical program where you not only learn about pathology, you not only learn about clinical disorders from different perspectives, but you also undergo a lot of clinical work under supervision of the professors, of course. You would typically have OPD trainings, you would have in-house trainings, a lot of would come. All right, and I think this is about MPhil in clinical psychology program. Now there might be some questions. I'll address it and then I'll take the questions. One of it would be whether MPhil in clinical psychology program is going to continue or it's going to discontinue, as there has been rounds going about by the UGC that it will be discontinued. RCI has already come up with a circular that MPhil in clinical psychology is not going to go anywhere. In India, MPhil in clinical psychology is must if you want to practice as a clinical psychologist. So it's there; it's not going anywhere. Okay, and there could be another question that if you want to do your PhD. PhD, what is the difference between PhD in psychology and PhD in clinical psychology? So basically, PhD program, as you all know, it's basically intense, rigorous, research-based program. And anybody who has a master's degree in psychology can enroll for PhD in psychology. But PhD in clinical psychology in practice takes people who are already clinical psychologists, and they are admitted, into this PhD in clinical psychology program. And there are 3 institutes: NEMHANS, CIP, that is Central Institute of Psychiatry, IBHAS, which had PhD in clinical psychology program. So you can do that, and you do your PhD, and after that you also not only practice, but also you can get into the teaching programs as well. And Psych B, again, I forgot to mention, it's not only clinical-based program, it also has rigorous internships and at the same time research as well. So Psych B is another program which is a gateway for your aspiration for being a clinical psychologist. Now there could be another question whether PhD in psychology people or masters in psychology people can practice or not. If you ask me, technically the answer is no, but you can practice provided you are training yourself in a particular kind of therapy, say solution focused therapy or a rational emotive behavior therapy, and you have learned that training, you have done that training, and you are taking the clinical work under the supervision of somebody who is a trained practitioner already. So if training is one part, supervision is a very important key. If you haven't done your MPhil in clinical psychology, why? Because it requires a lot of expertise in dealing with the clinical work, clinical cases. Clinical cases can pose a lot of challenges. No doubt, it is very interesting to work with a very puzzled mind. But at the same time, it can be very challenging because suppose if you're working with an obsessive patient, you have tried everything, but they are like at the end of it again saying that I am helpless. I'm again checking. So you may be kind of in a fix. So you need supervision for your clinical work. And also, if you're under masters, after masters you're practicing, or after PhD in psychology you're practicing, or otherwise also if you're a clinical psychologist as well, be open about referring your case to any other clinician if you're unable to handle your client what you're working with. So that's typically the work looks like, and I think the scope of clinical psychology is huge. It's huge in the sense like it's immense right now. The World Health Organization is already saying that, especially mental health was always a ticking time bomb, and with this pandemic, I would say that this has completely kind of has exploded, and the mental health cases are on rise definitely, and the scope in that sense is huge and humongous because India does not have the number of clinical psychologists at par with what is the demand of the patient load what we have. I mean, most of the colleagues what I talk to in Delhi and in Bombay, they're absolutely filled. They don't have time to accommodate. So the scope is huge. It's very much there. And not only that, you can work in the clinical setting. Of course, you can work as a researcher. You can teach in the MPhil clinical based programs. You can also work, like I'm working with the Institute of Technology, IIMs, which have now begun to take, consultants on full-time basis. So there's a lot of scope out there as well. You can definitely work after your masters in schools as school counselors. You can work definitely, it has now, if you know by now, ICSE boards, CBSE boards have made it mandatory for all the schools to have a school counselor. So the scope is kind of, like huge. You can work in the field of sports psychology.
Ma'am,
yeah.
Can you just slow down? Everyone is putting that question, to slow down.
Okay. Sure. I just wanted to finish off with the scope and then take questions. Okay, I can take questions. Would I be reading all the questions and then answering? Should I go by like that, or somebody's going to read it?
No, ma'am. You were talking very speed. The speed was very high, so we just requested, to slow your speed while you're talking. That was the suggestion.
Okay. I'm sorry about that. So, do you want me to repeat again, or should I just take questions?
Ma'am, you can continue what you are saying, ma'am. Whichever you feel like. We can take questions later after you complete whichever.
Okay. So I think I'll better take questions because that way, things will it will again get repeated. So maybe I can take questions.
Excuse me, ma'am.
Yes.
Ma'am, there is a concern from students as that, like, if you could slow down a little bit so that.
Yes. I've already taken that into account. I'm sorry about that.
Okay, ma'am. Thank you.
So, ma'am, would you like me to read the questions for you, or?
Yeah, maybe we can take the questions. Yeah, I think that would be better.
Okay. The first question that I can see here is, what if we do UG in India and PG abroad? How would we get a license to work abroad then?
How could you get a license to work abroad? So basically, if you do your masters in abroad, I can tell you about European countries. So what they do is basically, they have a forum of psychotherapists or psychologists where you have to register, and they even have personality or your criminal background check. So once you get that clearance, once you get yourself registered with the forum, you are then eligible to work there in the European countries, what I know. But if you want to come back to India, there is so far no parallel where you can come and start practicing that is recognized. I mean, there is no such parallel like that. Suppose you did your training there, come back here, and then you want to practice. There is no equivalent like that in that sense. But generally, nobody stops if you have to do training out there. But again, supervision would something which would be advisable in that case as well. If you want to work abroad, I think it is always better to do your master's there, because getting into the master's program, after you finish it here and then go there, you will anyway have to do again the master's there, because they don't recognize our masters in India. So you do it there, it is always better. It will be more easier for you to do and less time consuming as well, if that answers your question.
Okay, ma'am, then we have a question like, after PG in clinical psychology, can we do sports psychology? And another person is asking, can we become psycho-oncologist? So is it possible to go into different streams?
Definitely. I think there is, again, in India, the binaries are not very clear. So suppose if you are a clinical psychologist and you begin to work with in the field of sports, okay? So gradually you will begin to have your expertise in that. Although I am not very sure if any institute in India is giving any specialized training in sports psychology, but in abroad there are definitely, I think 1 or 2 institutes are there in India as well. So you can, get a super specialty in that, maybe from abroad, and then can work. Even if you do not do that, I don't think your training in clinical psychology will stop you to, work as a consultant in the sports psychology field or even in the psycho-oncologist. Because when you begin to work, you will get to see, the problems and the challenges of the people, who are suffering from cancer or who are, cancer patients. Eventually, you'll get a, forte in that. So there is no such, and I think in your MPhil clinic program as well, you will have internships and you will have postings in oncology department as well, which will give you some idea. You can always choose your specialization, in which field you want to work. After your training, you can be an expert in child psychology, you can be an expert for adult. Years of practice will give you that command over your work.
Right.
It can be done.
Ma'am, could you tell us about the sub-specializations in clinical psychology in India? Because one person here, he's saying he doesn't like working with violent and difficult patients. So is there any provision?
Okay, so let me tell you, when you are a student of clinical psychology, you do your MPhil in clinical psychology, you would be exposed to every kind of work, okay, possibly. Children, then, toddlers, adults, elderly, neurological cases, organic cases, how to handle that. You would be exposed with everything. When you begin to practice, you can obviously refuse to say, you can refuse that, okay, I am not, going to work with the violent patients, which you can always say. But there is no subspecialty as such in the clinical psychology program, but definitely you can choose the kind of, work you want to do for yourself. Like nowadays, I am working a lot with the teenager group, with the young adults. So that has kind of, maybe if I continue to work in this line for another 10 years, this could become my specialty. Before this, I have been working with adults and children. So, you can always choose which category, which zone of people you want to work with. And then you can, go on working with that. There is no hard and fast rule you have to do. And SAB, it is advisable. If you're unable to handle any particular case, you're not feeling good about it, it is better not to take it. If that answers your question.
The next question we have is, can a clinical psychologist give medications after getting license?
No. Clinical psychology work is all about talking. It's talking is a very, in a general way I'm saying. I mean, it's the work involves psychotherapy, different kinds of psychotherapy, whether it is psychodynamic oriented psychotherapy, behavior therapy, solution focused, REBT, CBT. It's all, you can say in one word, it's a talking or a listening cure. Okay. It's based on, for scientific techniques and applications, but a clinical psychologist cannot prescribe medications at any cost, neither Psych B, neither PhD in psychology, neither PhD in clinical psychology. Only a trained psychiatrist can do that. Who's a psychiatrist who does his MBBS and then do MD in psychiatry is eligible. We are not eligible to do that.
Right, right. Okay. Next question is, can you please elaborate the difference between advice, guidance, counseling, and psychotherapy?
Okay. So I think I would put up advice and guidance in just one thing. So basically, like, what I am right now, if you come to me and ask me, "Acha, it's raining and I have to go to, somewhere. Should I go or not?" So, you're asking me directly a suggestion. Okay. So I can tell you, "Hey, the weather looks very bad. Don't go. You may get stuck if there is, water logging." So I'm advising you directly and giving you a suggestion out there, a guidance maybe you can say. So that's one thing. There is a direct suggestion and I'm offering you a direct solution over there. Okay. Counseling is basically, I'm educating you about the pros and cons of something. So suppose you ask me whether I should go for a clinical psychology program or not. Okay, I can say, okay, if you go for this program, these are the pros. It's a very interesting program. You get to meet different range of people with different kinds of mindset, and it can be very fascinating. At the same time, this can be very challenging as well, and can be very, demanding as well, because you have to be prompt when you see patients. So I show you pros and cons, and I educate you about the process, and then I ask you to choose for yourself. That is counseling. Psychotherapy is basically a part of it at times is also guidance. Suppose if my patient needs medication, I would advise them, look, it's not working, maybe you go for medication. Part of it is guidance, very little part. Part of it is, of course, psychoeducation as well, where, I have to tell them what is their disease looks like, what the disorder looks like, and what, they can expect the treatment program. But psychotherapy typically involves working with the deeper issues, the problems with which the person is coming, the complaints with which the person is coming. We will work with them. We will help them, to alleviate that. And that typically involves a self-exploration process with the use of psychotherapeutic techniques. So here, guidance plays, very little role out there. So the idea is, to encourage the person to explore their thoughts, feelings, and then, proceed towards resolving those problems. That's basically the difference. It's more deeper. It's a clinical work. Counseling is not, clinical work. It's more of a psychoeducation and a guidance. Advice is a direct suggestion. So that's basically the difference. Does that answer your question?
Okay. Thank you so much for this lucid explanation about the differences. And the next question we have, is it possible to pursue masters in psychology if a student comes from a different background, say commerce or anything? Is it possible?
I think it is difficult with a good university, because all the good universities will expect you to have a graduation. I am not very sure. Probably IGNU may have that option. I am not sure. Honestly, I'm not sure that you can do it.
Right.
Vipasha, do you know about it?
Ma'am, even I have heard that it's better to have a psychology background in order to do a PG, because otherwise PG is just an advanced level of studying psychology, what you have done in graduation. So graduation is basically, it sets the stage for your knowledge about psychology. So then I think a background in psychology will help eventually.
Yeah. So I think it's not all universities, like I can tell you, like UGC group universities do not give that entry. We do not have psychology honors. I mean, typically for masters, you need to have not only psychology, but psychology honors, what I mean.
Right.
So
even we do the same thing, right?
Without that, you cannot do it. I mean, not from good universities like Delhi and Calcutta and Madras, all of them.
Yes, I know about Calcutta because I did my UG PG from Calcutta University. So the trend is that only you have to have a honors in psychology.
Correct.
So next question coming is, after PG in clinical psychology, can we do sports psychology for MPhil?
There is no MPhil for sports psychology. Okay, there might be a diploma. There might be a, some institute offering some sort of training, but typically a diploma. There is no degree program in sports psychology. So far, I do. I don't know if Patiala University may have. I think I am not sure. You can check it because Patiala University was opening up with something like that. I don't think again it's a degree; it's a diploma. But like I can tell you, you don't need to have typically a diploma and a degree in sports psychology. If you want to work also, if you have a training in clinical psychology, you begin to work with a sports professional, you will eventually pick up what sort of work they bring, and you will have to work a lot in coordination with physiotherapists, occupational therapists. Also, there is one more, not orthopedics, but there is one more branch. So you will have to work with them as a team. So, but again, as a sports psychologist, what would you do? You would have to do counseling and psychotherapy with them, people who are not being able to perform. So all you basically require is a skill in therapy, skill in counseling. So if you have that, if you've already acquired that in your training, you can apply it anywhere. See, that's the beauty of this profession, It trains you, it gives you an orientation about a clinical program. That's what I was trying to tell in the beginning. When you get a patient, you can obviously get a clinical problem like depression, anxiety, some psychotic problems, personality disorders. At the same time, you can also have, like problems like, where the people are struggling to find about who they are, but otherwise they are fine. So they can be, lots of issues, and your program will expose you with that. And, with time you can get seasoned. So you don't have to worry about a degree and a diploma per se. If you have to be good in clinical psychologist and good as a psychologist, you really need to kind of keep observing human behavior, not typically clinical mental health patients only, but anything in literature, anything politics, all of that would give you an idea. So don't worry about the special degree. Your clinical psychology program is enough for you to venture into any specialty or any field you want to. You would not be stopped, at least in India, I can tell you.
Right. Okay. Then we have another question. Is it a myth or a fact that scope of clinical psychology is better abroad?
It is, I think, everywhere. Why not India? Why are you not considering India? Whoever has asked this question. I mean, it is of course good in the sense that, I think it's both. In abroad, there's just a little difference that, insurance companies probably kind of, have recognition and they kind of sponsor it. It's very, in terms of money, maybe you can earn a lot because, most of the psychotherapists are not covered under the government health programs. So maybe you're into private consultations, you may end up earning a lot. But in my experience, I can tell you, I told you, my colleagues in Delhi, Bombay, everywhere, they're like absolutely filled. They don't have time to accommodate anyone. Scope is equally good in India as well. People may be kind of shying away to openly say that we are consulting, but you will, and I'm telling you, like you would get people like politicians, actors coming to you for consultations. So the scope is, it is good in India as undoubtedly. Yes.
So the next question that we have is, yes, is MSc counseling from IGNOU is recognized for admission to MPhil clinical psychology?
Yes, it is recognized. It is recognized. You have to have minimum qualification and minimum percentage 55 or 60%. Of course, your entrance examination would be very important. You have to crack with basic percentage.
Next question.
Sorry, ma'am. Even Annamalai is also recognized. Sorry.
Next question we have is, what is the procedure to get specialization in CBT therapy? Can we specialize while doing our PG?
Of course. I mean, if you can manage time, first of all, you will have to look for a good institute who can offer you a training in CBT, okay, while doing your master's. And of course, if you can dodge time between your master's program, you can certainly do it. There's no harm in that. In fact, while I was doing my master's in clinical psychology, I at the same time also did a postgraduate diploma in psychiatric counseling. So you need to see whether you can manage time or not. And there is no problem. You can do it while, but yeah, provided that institute also do not have a prerequisite condition that you got to be masters. There are some institutions who have a prerequisite minimum masters. If that is the case, then not. But if it is not the case, you can of course do it. I don't think there's any problem in that. Now, if you ask me which are those institutes, I'm sorry.
Okay. Okay, next question we have is, could you also please stress the fact on incompetence anxiety in the beginners who are pursuing clinical psychology?
So regarding incompetence, I can tell you when I began, looking at cases, I was absolutely like, I'm in nowhere. In fact, I always wanted to do clinical psychology, and I was told that, and I did not know Bengali. I was from Punjab, and my HOD told me, look, if you want to do clinical psychology, you better learn Bengali, just 2 months. So I was in a very bad stage at that point of time. But I can tell you, this incompetence can be handled in 2 ways. One, your own motivation to learn, your genuine effort to help your client, your patient. If you're genuinely interested in helping the patient, even if you're not competent, it helps because believe me, after more than 10 years of experience, of course, techniques and all matters, but empathetic listening is something which does a lot of wonder. Besides that, you will obviously have your supervisors who will supervise your work, and you should be sailing through. And we all learn like that. But yeah, your motivation to learn and your sincere, genuine concern to help your client to reach out, to understand him, is not going to go waste. Trust me, your patient will stick to you if you have it with you. So don't worry about that.
Next question. After doing UG and PG in clinical psychology, how can I work in an organization?
After doing my UG and PG in clinical psychology?
Yes.
Okay, so suppose organization can be like what? You can apply, if there are vacancies, you can apply, or you can give your post applications for institutes, who have a provision for psychologists to HRs. Like say if you want to work for a school, you can around say work in a school as a school counselor. That is one very good, way, and I would encourage you after doing your masters, if you get a chance, please work with school children. You really, really learn a lot. I was very skeptical before, after my MPhil that, MPhil करने के बाद school में कौन काम करता है यार? But I don't know if you understand Hindi, but believe me, that was one of the most, beautiful experiences. You really grow with children. I mean, you grow as a psychologist because the kind of questions they ask you, and you see the pathology setting in. So it's wonderful. So that's one way of going about it. Schools, they can be some academic institutes where you can work as a researcher in some research projects in your universities as well. There could be some professors who are looking for, research associates or research assistants. You can work in the research programs. That could be another thing. There could be like, again, cancer hospitals who are looking for, psychologists who can do the psychoeducation for the cancer patients. Like, what can they expect with this cancer being diagnosed? What is the course of illness? Even in the AIDS, counseling for the AIDS, medical illnesses, chronic medical illnesses. And one of this is AIDS is also very important. You can work there after your master's. So the scope is huge. It is, a lot in that in schools, then as I said, AIDS, chronically ill patients, all of that can be easily done.
Ma'am, I wanted to add something here.
Yes,
just correct me if I'm wrong. Ma'am, in organizational setup also, like these HR people, and management, they always come up with these employee assistance programs. So where employee counseling and mental health of the employees, these are also very much highlighted nowadays. So clinical psychologists, I think they even have a scope over there also. Like if any employee is facing any kind of trouble in the organization, stress, anxiety, or alcoholism, substance abuse, anything. So I think they can have a scope over there as well in organizations, in corporate organizations, to be more precise.
Yes, ma'am. Thank you for pitching in. You are absolutely bang on correct. So I was just trying to answer the master's thing, but yeah, ma'am is bang on right. Even in the corporate sector, there is a huge demand and up, and this demand is very up for mental health counseling, for even having training programs about different kind of stress management, in the corporates, even PSUs, HPCL, all of them, they even hire your services for recruitment purposes. Now, many companies have a policy where, the psychologists have to be on a panel before they kind of, take a permanent, before they hire an employer,
Right.
to recruit. So there's a huge scope out there. I mean, clinical psychology is, quite up right now in different ways. Recruitment, you call it, and in many, many of it. I know for PSU for sure, they definitely have a psychologist in fact.
Right. Thank you, ma'am. Next question is, in order to become a criminologist, do we need to have a background in clinical psychology?
See, clinical psychology background will obviously help you in wherever you're going to work. Okay, I don't think it is necessarily you have to have if you're aiming to be a criminal psychologist. Gujarat Forensic Science University is one university which offers a training in clinical psychology program. So you can look into their website, and if you're interested in that, can do it. But again, the scope I think is limited in the sense in India at least. Unless you're working with the central agencies, which is very rare. But yeah, clinical psychology is, I don't think, a compulsion if you have to do it. There's a separate program altogether which Gujarat Forensic Science University offers.
Okay.
But training would help. Training would help you for sure. Yes, sorry, ma'am.
Okay. So next question, ma'am, we have is, how does neuropsychology differ from clinical psychology, and how does their field of work differ?
Okay, that's a very interesting question. And also, this is something which is again a very popular field now, neuropsychology. Okay, so typically the work of neuropsychology differs in the sense that they focus on the neurological portions, and like suppose if you have a schizophrenic patient. Okay, so in psychotherapy, if it's a patient is a very chronic patient, you cannot typically work a lot with that patient because the patient is psychotic. But there are certain parameters like training that patient, suppose in attention, training that patient in the sense that for concentration. So there are neuropsychologists basically develop certain programs in training the cognitive abilities of such group, whether it is schizophrenia, whether it is dementia, okay, whether it is dementia, it's a range of problems. It has Parkinson's, which has Alzheimer's. So they basically work, with the research part, and also they come up with a training program to work with patients who have neurocognitive difficulties, especially cognitive difficulties. So they will typically work with ADHD students, ADHD children, and would teach them how to increase their concentration. They'll come up with such programs. So that's where the remedial part becomes different. The mode of remedy is different. Clinical psychologists would mostly, be doing with, say, if you take an example of ADHD student. Clinical psychologists would focus more on the behavioral training, okay, how we can control the behavior, whereas neuropsychologists would work on, with programs, how to improve the concentration of that student. That would be typically the work looks like. But again, the offshoot is, the main thing is again clinical psychology, the base, and then you specialize in neuropsychology. And there's a lot of another work. We work with basically cognitive functions, different sets of judgment, planning, decision making. Even you can work with say OCD patients who have a lot of problem with the decision making. So they'll kind of work with that, how to improve in that sense. It's a very upcoming field now, very popular.
Next question is, do we get hands-on experience with psychotherapies while doing MPhil?
Of course, yes. Your MPhil in clinical psychology, Psych is a clinical program, and we do lots and lots of clinical work. I mean, there is a prescribed hours of work what you have to do, and for your submission, you have to have submit 5 adult cases, 5 children cases for sure, supervised cases. Otherwise, you're not allowed to even sit, for your final exams. So that is the criteria to pass. You will have to have, a lot of clinical work. As I was telling you in the beginning, maybe I was very fast. You will even have to have your OPD trainings. You will even have to, go for your in-house trainings. Like say, if your institute has like an enhance, so you have an in-house setup where the patients are admitted. You will have your postings there. So there will be a lot of Clinical training is what maximum you're going to do throughout the day, and your theory classes would be like, typically would be early in the morning or late in the evening. Throughout the day, you're only doing clinical work, mind you, and right from the very first or the second day. So don't think it's going to be like, you don't know, so it won't be, you won't be working. You will have to work straight away.
Next question we have is, how different is neuropsychology from computational neuroscience?
Neuropsychology from computational neuroscience. I think it will be very similar, but I'm not very aware of it, to be very honest. Let me admit it. Computational neuroscience should be something, where the neuropsychological programs are again, combined with the computational work. I honestly have much idea about it. So I should refrain myself from saying too much about it. But yeah, I can tell you there are many institutes in India also, like IIT Kharagpur, IIT Kanpur, who work a lot, on the cognitive science field, and they use a lot of computational models for understanding mind and brain, and they keep developing a lot of programs to assess different functions of the brain. What I understand is more than remedy, they are more into research. This I know for sure. So more than intervention, it is the research what they do. Maybe later they can use those programs in intervention as well. I still do not know how efficient those programs are, unless you're working with the patients with organicity, with people like who have conflicts, who want to speak, but then those programs will not work. Those computational neuropsychological programs typically would work best with cases of organicity. ADHD people who are chronic schizophrenics, epilepsy people, dementia group. With that, it works better. So you have to understand what is your interest. If you're more interested in computers, research, brain, neurobiology, neurochemistry, then probably neuropsychology is your field. But if you're more interested in understanding the dynamics of human behavior, how human mind functions, then probably clinical psychology should be your choice.
Next question, how do you employ psychoanalysis in your work?
Okay, thank you for asking that question. I mean, in my work, typically over here, it is very difficult to do psychoanalysis because one, the students, are here for a very short span of time. If it is BTech, then it is 4 years. And honestly, BTech students do not have that much of patience to come in therapy. They're like very good. They're like, acha, ye ho raha hai, bata do, karna kya hai? I mean, they're not even into exploration. They're typically looking for advice. This ye problem hai, this solution give it. So with them, it is very difficult. Even if I have to do, but having said that, there are certain students and certain faculties or staff who have difficulties. So psychoanalysis is something which I couldn't use up till now in this setup. But psychodynamically oriented therapy, definitely I have used. So suppose I had got one student I am working with right now. So, he came to me telling me that, he is working on an automatic vehicle, driverless car. So there is no driver in the car. He's working on that model to make an automatic vehicle. And the next slide he says, what, interestingly, my father is a truck driver. So you see, there is, it may sound very unrelated, but it is very important for the mind of a clinical psychologist, psychoanalyst for sure. Because what is the patient giving you? In one sentence, he's saying, I'm doing a research on a vehicle which works without a driver. And in the second line, he's saying, but my father is a truck driver. So there is some dynamics working in. So with such clients, typically I would be working on a psychodynamic mode. So I use psychoanalytical informed training with such patients, but of course, psychoanalysis is not possible in this setup. I haven't done classical analysis I don't practice classical analysis, but yeah, when I say classical analysis, I mean typically how analysis works in this setup so far. But of course, it helps me to give interpretations. And it also helps me to address students, when they come up with their dreams. It definitely helps you with slip of tongues. And it also helps you when some of your clients keep forgetting the appointments. You can really work a lot over
there. The next question we have is how to get in health psychology after MA.
After MA, if you want to go for health psychology, I think it's very easy. If you're not aspiring for in psychology, not clinical psychology, then you can typically, can start working with any hospital or oncologist or as a, as I said, AIDS. So, any chronic illnesses, you can begin to work as a counselor there. where you're educating people with chronic illnesses. In that sense, you can work. That can be done, definitely. So it basically would involve you to get associated with the organization which have patients like thalassemia. Thalassemia is another problem which is very kind of challenging. Hemophilia. So there are societies, where our patients, who kind of their living is very difficult because of the chronic problem they face. So you can associate yourself with such institutes, such organizations, and can begin to work as a consultant.
And ma'am, can you please tell us about the salary range for a clinical psychologist?
Okay, so if you're in a private practice, typically now people charge something about 500 to even 5,000 per session. Don't get perpetrated by that. In Bombay and Delhi, people typically charge 4,000, 4,500, 5,000. So that is kind of a rate. Usse bhi zyada, I have heard Hyderabad people charge even more than that. So 500, I said, in Calcutta it is very cheap even now. So that is the basic. So basically, if you're a consultant yourself, you can definitely set your rate on your own, what you think is the right thing, based on what locality you are, how much experience you have, and what kind of clients come to you. So you can set your rate in that sense. And of course, we're not talking about how to pick up what kind of work you do as a clinical psychologist or how you charge your fees. Basically, we even get into this contract that if you come in once a week and you cancel your sessions without informing 24 hours before, then we charge for the missed fees. So those kind of things can be done. But if you're working in an institute, it again depends. If you're working with a good institute, there are institutes for school counselors, they're paying around 30, 35,000, full teacher scale. Okay, they pay if you're a full-time employee. IITs pay very good in the sense, I would say, if you are looking at working as a student counselor in IIT system, I think, and if you're in the regular pay, they pay very good. They pay level 10 as per the 7-pay commission, which comes out to be around 60,000 per month, which is good. And if you're working as an associate in the IIT system, so it would be typically something from 30 to 60 to begin with. If you're in the IIT system, IIT or IIM system, they pay good. But yeah, nowadays I think it is more or less coming to this only. Very not very reputed institutes would give you around 15 to 25 ka range. Good institutes would give you something around 30 to 60. That would be the range for a CP, clinical psychologist. But again, if you are a teaching profession, then this becomes a little higher. If you're into teaching, because in teaching you get the academic grade, so that way your salary becomes more. But if you're a clinician, have a lot of patients, and you're charging good, you can really make 3 lakhs, 3.5 lakhs per month. Delhi Bombay mein log karte hain.
Next, someone asked, which is more preferable, PhD or Psych?
It depends upon PhD or Psych. It depends what you want to do. Okay, before I answer this, Vipasha, am I fast now or it is now okay?
Oh, ma'am, you were good to me from the very beginning.
Okay. I know I can be fast for some people, so yeah.
No, it's fine.
So it depends upon, I would always say if you have to choose between this and that, the criteria should always be in your mind is that what you want to do. If you want to work as a clinician, definitely Psych is the best, or ambulant clinical psychology. If you're looking yourself as a researcher or you want to be into a teaching profession, then PhD is something you should be doing, because PhD is more about research and you go into the teaching profession. So what is your interest, that you should do. But if you think mujhe teaching bhi karna hai, practice bhi karna hai, then probably go for MPhil, 2 years, and then you enroll for your PhD. But that is a long journey.
Thank you, ma'am, for clarifying that. Yeah, thank you. And another question we have is, can we do PhD from a foreign university and practice or get employed in India?
See, I'll tell you, abhi bhi na India mein there are no fixed rules. If you have a foreign ka degree now, even if you have a diploma, you'll be like, taken by these big hospitals, corporate hospitals like Fortis and Amri, all of those range, you must be having some in your area as well. So if you have foreign ka some degree, some diploma, even a training in CPT or SFT or REPT or anything for that matter, corporate hospitals will be happy to take you and flag that, because that's how they kind of attract the patient. So that is absolutely done. Nobody would question, because in India the laws are still not stringent. If you But if you ask me, as such, again, there is no clarification by the RCI whether they can do it or not. But till now, RCI has not even stopped anyone. RCI has not even stopped anyone from practicing. But again, if you come here, it is better, when you begin to practice, get in touch with a trained professional, trained practitioner who can supervise your work so that, there are no questions asked. That is the best way to go about it.
Ma'am, can you tell us the duration of PsyD?
4 years
4 years.
after your master's, and after every 2 years.
Okay. The next question we have is, so counseling psychology is more of an interaction with people, right? So counseling psychology, it has to be more like interaction with people. Someone has asked. So is it so, ma'am?
Yeah, I mean, your work would involve working a lot with people. So psychology is a profession which, is typically involved about human behavior. So if you're a researcher, you're working with the human mind. If you are a clinician, you are working with humans. So yeah, it is, the interface with the human mind only. But interaction doesn't mean, you're allowed to have social interactions with them. No. I mean, once a patient, forever a patient. You cannot have any kind of, personal contacts with your patients. Neither you can take any papers for them. So, you would have people who are politicians. Like, I used to work in a clinic, which was not a very posh clinic. So, one politician used to come and he would always say, "Madam, kaise chamber mein baithti ho? Badhiya chamber banwa do kya?" I'm like, okay, I don't need that. So, you will get patients who would, offer you and tempt you with things. Interaction, yes, because you have to understand the human mind only for the sake of understanding them and helping them, not social interactions.
Ma'am, I'm afraid to say that we have come to the end of our session time.
Right.
And so that was really a very enriching and interactive session that you have given us with lots of knowledge and scope about clinical psychology, the different areas, the differences, and how to utilize the foreign degrees and Indian degrees and how they can be applied in foreign and in India and something. So thank you so much, ma'am, for this very wonderful and interactive session for us. And I'm sure each one of the participants here had cleared all their doubts, and we really enjoyed your session. It was a learning experience for the faculties and researchers also. So thank you so much.
Thank you so much, Vipasha ma'am, and I once again apologize for being very fast. I do understand I have a very accelerated speech. At times, I can be very fast. Apologies for that, but I hope I made sense for some of you at least. And I have shared my email address. If ever you have any question you would want to ask me, please feel free to write to me with the reference of this conference. I'll be happy to answer your questions. And once again,
one last question I want to ask. I'm Lucy.
Vipasha ma'am, can I take that?
Okay, this last one then.
Ma'am, after doing the master's from psychology, like if it's from IGNOU or any other university, so thereafter can we pursue the counselor as a counselor, or we have to do MPhil?
No, ma'am. I couldn't see your name. You can definitely work as a counselor. After masters, nobody can stop you to work as a counselor. That is very well within the right, because you are using the word counselor. Problem is if you're working as a CP after doing your masters, So,
ma'am, for masters, do I need to do clinical psych as a subject as clinical psychology masters, or just a psychology masters would do?
See, if you are just doing psychology, any other specialization, you can still do it. But if you have a specialization in clinical psychology in your masters, that will definitely help, because you will have good idea about what disorders are, how to make a diagnosis.
What's the difference in counseling psychology and this clinical psychology?
See, basically in clinical psychology, you will learn about the pathology, you will learn about the disorders and the treatment part as well. Okay, both. In counseling psychology also, you would learn obviously about the pathology, but the focus would be probably more on the counseling skills, how you would, use that. That how you would work it. You would learn different kinds of counselings more. In CP, it is both. That will give you a more comprehensive picture. So counseling psychologist, the work is overlapping. There is no very fine division as such. So, either of it would do and will help you to pursue your aim as a school counselor or a counselor in, health institution like that. That would work, definitely would. Either of it should work because both will have overlapping courses. But clinical psychology, what we had was, a more intrusive program in enriching program in pathology and treatment process both. Right?
Thank you so much, ma'am, for clarifying these doubts, small bits and pieces of doubts. And with this, we come to the end of this plenary session. And thank you to Dr. Gagandeep for our panel. I'm sorry to say, dear, but we are actually running behind the schedule. So if you have any queries, just look in the chat box. You have ma'am's mail ID.
You can write
directly contact ma'am, and she will help you out in all stuff.
I'll be happy to write. I may be late, but I'll definitely reply back.
Yes,
my words for you.
Absolutely. Thank you so much, ma'am, for this wonderful session. And I hand over the mic to the organizers now.
Thank you, Vipasha, ma'am. Thank you all.
Thank you. Thank you.
I'll leave the meeting. Thank you all.